Welcome, thank you for joining us. Today we're going to talk about a common worry, losing your health benefits if you go to work. You might be surprised to hear that this isn't true. Throughout this session, we'll share many resources that will be available on the California Department of Rehabilitation or DOR website for you to find anytime. To access all sessions in this training series, click on the Programs for Social Security Beneficiaries link on the DOR website, www.dor.ca.gov. Important note for everyone. Before we start, this session doesn't determine if someone may be eligible for Social Security disability benefits or other government services. The information presented today is general and may not include the most recent changes related to today's topic, including annual income limits. Rules and programs can also change with new laws or updates, which may not be reflected in today's session. We recommend that you consult directly with Social Security, a work incentive planner, or other professionals to get accurate information that best fits your personal situation. Let's look at the second common myth. If I go to work, I'll lose my health benefits. Social Security has special programs to help you keep your health benefits while you work. These rules are meant to support you, not take away your health care. If you want to work, you don't need to worry about losing your health coverage. The rules are designed to help you transition to work smoothly, and there are options available to make sure you can keep your health care. Now let's learn more about how these programs work. You don't have to figure this out on your own. There are programs and resources to show how you can work and still keep your health benefits. Use these supports to help you feel more confident about going to work. Let's look at some great programs to know about, and don't worry. At the end of this session, we will tell you where you can find all the contact information for each resource. Here are some basic resources to help get you started. The Department of Rehabilitation, or DOR, provides information on Social Security work incentives and the Ticket to Work, or TTW program, which helps people understand how getting a job can affect their benefits. They provide personalized benefits analyses and work incentive plans, so you feel confident going to work and keeping healthcare coverage. The Social Security Administration, or SSA, provides various work incentives and supports, which allow you to keep your benefits while trying out work. The Ticket to Work program is free, completely voluntary, and the program includes protection from continuing disability reviews, or CDRs, so you have the support you need. Disability Rights California, or DRC, is an organization that assists in explaining work incentives, making sure people with disabilities know the special rules that help them keep their health care while working. The Disability Benefits 101 website, or DB101, offers clear and understandable Medicare and Medi Cal benefit information, giving you power to make informed choices while supporting your health. The important thing to remember is that you don't have to lose your health benefits just because you start working. There are programs and supports in place to help. Now, let's explore how these can be useful for different situations. We're going to discuss the healthcare program options by benefit type. These programs help you make smart choices about work and healthcare. We're going to start with Medicare employment supports, which are Social Security Disability Insurance, or SSDI specific. After 24 months of benefits, you're automatically enrolled in Medicare Parts A and B. Let's talk more about Medicare and how it works when you are working. There are rules in place to help you keep your healthcare while you work. Even after your trial work period, you can keep Medicare for up to 7.5 more years with the Extended Period of Medicare Coverage, or EPMC. If you still meet Social Security's disability rules after that, you might keep it even longer. Additional assistance is also available. Medicare buy-in programs, or MSPs, help people with limited income pay for things like premiums, co-pays, and deductibles so healthcare stays affordable. The Qualified Disabled Working Individual, or QDWI program, lets people with disabilities keep their Medicare coverage while they work, even if they're earning money. So getting a job doesn't mean losing Medicare. There are programs and protections to help you keep your health care while building a career. Now let's switch gears and talk about Medi Cal, also known in other states as Medicaid, and how it helps people who receive Supplemental Security Income, or SSI, keep their health care while working. SSI has special work incentives to help you become more independent while keeping your essential healthcare coverage. These programs support you on your employment journey so you can focus on building your future. Let's learn how these incentives work. Concerned about maintaining Medi Cal coverage while working? Here are programs that can help. First, for Section 1619B, if you earn too much for an SSI cash payment, you may still get Medi Cal if you meet certain requirements. Social Security uses a threshold amount, which is about $64,000 per year. Next, the 250% Working Disabled Program, or WDP, helps people who are working stay eligible for Medi Cal, as long as earnings stay below a certain limit, at least $79,000 per year, and you don't even pay monthly premiums. The key takeaway is that these programs keep you covered while you earn. Staying informed empowers you to make the best decisions. Remember, you have options. Working and receiving health benefits can go hand in hand. The right balance is possible, and you've got tools to make it work. You don't have to figure everything out on your own. There's help available if you are thinking about work and how it might affect your health benefits. Learn how work impacts your benefits from trusted resources like Social Security, DOR, the DB 101 website, and the Disability Rights California website. If you are already working with the Department of Rehabilitation, you can ask your DOR counselor to refer you to a Work Incentive Planner, or WIP, for personalized guidance to help you understand how employment may affect your Medi Cal or Medicare benefits. If you are not a DOR consumer, there's still support for you. You can connect with your local Work Incentive Planning and Assistance, or WIPA, project, who can help you understand how working may affect your health benefits. You can find all the resources mentioned here on the session page. As you can see, you have options. If you are receiving Medi Cal or Medicare benefits, you can explore work opportunities without fear. Here's what to remember from today. Pursuing employment is a significant step toward independence. You can explore job opportunities without losing your health care, and you have support while you adjust. Explore your options, get advice, and take control of your future with confidence, knowing support is still available while you adjust to these new changes in your life. The possibilities are endless. We hope that after learning about all the programs, incentives, and resources available, you feel more confident about giving work a try. Now you know you can keep Medi Cal or Medicare while working, with plenty of support available. In our next session, we'll talk about another common worry. If I have to stop working again, I won't get my benefits back. We'll explain how the rules make it easier to restart your benefits if you need to, so you can take steps toward work without fear of losing your safety net. If this is your first time viewing one of these sessions, go to the DOR website, www.dor.ca.gov, and click on the Programs for Social Security Beneficiaries link, and then click on the Benefits to Independence 101 link to begin the program. You have now finished Session 2 of Module 1 in the Department of Rehabilitation Benefits to Independence 101 program. Before you go on to Session 3, please go back to Benefits to Independence 101 Module 1, Session 2 page to do the activities and look at all the resources we talked about in this session. We are happy to continue this journey with you in Session 3, where we will continue building on what you have learned here today. Keep up your journey toward independence.